Hello, my name is Dr. Gary Wortz, and I'd like to welcome you to Commonwealth Eye Surgery. You could have gone anywhere for your cataract procedure, and we are really honored to be able to take care of you. We're going to take you on a guided video tour that's going to explain a lot of the confusing language and terms surrounding cataract surgery. Terms like cataract, astigmatism, presbyopia, and multifocal lenses will be explained in ways that are very easy to understand. You're also going to hear from some patients who've had some different types of lenses implanted in their eyes and hear from them about their experience and why the lens has really helped improve their quality of life. The more you can educate yourself on the options for cataract surgery before you come in for your consultation, the better. You know, in the old days, there was only one lens choice, so it was really easy. But as technology has evolved, we have some great options for you, and we really want to have you and your family perhaps on board with having a conversation about what type of lens is going to be best for your lifestyle. So I ask that you watch all of these videos. It only takes a few minutes, so it's not going to be too much of your time. Feel free to share this with your family and friends as well. Sometimes they can give nice perspectives also. And be ready when you come in for a consultation with your questions. We look forward to them, and we look forward to taking care of you. Thanks.
If you have cataracts, you're not alone. By age 40, over 20.5 million Americans will have started to develop cataracts. But a lot of people don't know much about cataracts. Here's how they develop. Cataracts are a normal part of life. You start off with a clear lens that focuses light for clear vision. But over time, protein builds up, then keeps getting denser, until it eventually clouds the lens, making it more difficult for light to pass through and clearly focus. This causes symptoms like cloudy, blurry, or dim vision and sensitivity to light and glare. Cataracts can even make colors appear dull and faded. Symptoms like these slowly develop over time and can end up making everyday activities more and more difficult. The good news is you can correct it with surgery, which replaces your old cloudy lens with a new artificial lens. Cataract surgery is one of the most common surgeries in the country. Nearly 4 million of them are performed in the U.S. every year. And based on a Johns Hopkins report, 95% of cataract surgery patients in the U.S. experienced improvements in their vision. So it's a really successful surgery. Are you ready to get on the path to better vision? Talk to your eye doctor today about cataract surgery and your procedure options.
You may know that almost everyone gets cataracts. But did you know that up to 52% of people with cataracts also have trouble seeing far away because of astigmatism? And almost 100% of people over 40 start having trouble seeing up close because of an eye condition called presbyopia. As they age, many people will have all three of these eye conditions at the same time. So let's learn how they can affect your vision. If you have cataracts, it means proteins are built up on the lens inside your eye, clouding your vision. If you also have astigmatism, your irregularly curved cornea distorts light entering your eye, making things appear blurry. And if you also have presbyopia, it means your lens has become inflexible over time, making it difficult for the muscles around the eye to focus your near vision. When you have all three conditions, your vision is cloudy, blurry, and you have difficulty seeing up close. Fortunately, Alcon created lenses that correct cataracts, astigmatism, and presbyopia in one procedure to help you clear away the cloudiness and focus across all distances. Best of all, a multifocal toric lens can help reduce your dependency on glasses after surgery. Talk to your eye doctor today about lens options that also correct astigmatism and presbyopia during cataract surgery.
You could look at cataract surgery as simply a procedure that almost everyone will eventually need. But when you take a closer look, you'll find a once-in-a-lifetime opportunity to brighten your future by enhancing your vision.
As a result of this surgery, which has made my life so wonderful as far as my vision goes, I would have to say I am a pan-optimist.
Pan-optimists see life differently, because with the PanOptix trifocal lens, you can get more out of your cataract surgery. Cataracts form in the natural lens of your eye and block light from passing through, which prevents you from seeing clearly. During cataract surgery, a surgeon removes your clouded lens through a tiny incision and replaces it with a new clear lens. This is one of the safest, most common, and most effective procedures performed today. And technology like the PanOptix lens makes it possible to enhance your vision beyond basic cataract removal. If you have cataracts, everything you see is likely hazy and dull. After cataract surgery, things will look clearer and brighter. However, your basic cataract replacement option, the monofocal lens, only clears your vision at a distance. You'll likely still need glasses to see up close. The PanOptix lens lets you see far away, at arm's length, and up close with clarity, so you can see all the vibrant details of your life. With the PanOptix lens, you can enhance your vision for clear, complete focus, discover bright, vivid colors, see effortlessly without blurry zones, and reduce your need to wear glasses.
There is nothing that I can't do with my vision. It's been wonderful. My name is Sandy, and I am a pan-optimist.
Look on the bright side of cataract surgery. Seize life without cataracts. Ask your eye care professional about the PanOptix lens today.
The way you use your vision shapes how you live your life. That's why cataract surgery is more than just a common, simple procedure. It's a chance to rediscover what makes your life remarkable. The AcrySof IQ Vivity lens helps you see clearly at crucial far and intermediate distances while still providing functional near vision. It is a cataract replacement lens that gives you the focus you need where you need it most. Cataracts form in the natural lens of your eye and block light from passing through, which prevents you from seeing clearly. During cataract surgery, a surgeon removes your clouded lens through a tiny incision and replaces it with a new clear lens. This is one of the safest, most common, and most effective procedures performed today. If you have cataracts, everything you see is likely hazy and dull. After cataract surgery, things will look clearer and brighter. However, your basic cataract replacement option, the monofocal lens, only clears your vision at a distance. You'll likely still need glasses for the moments when you need to see things up close. The Vivity lens delivers sharp, clear vision far away and at arm's length. The Vivity lens also helps you take advantage of vision up close, which means that while some patients may still need glasses for close distances, many are able to leave glasses behind. The Vivity lens renews your lifestyle and helps you feel comfortable and confident with your own vision. You can see clearly and enjoy more of the things you love, like driving a car, cooking your favorite meal, or playing a game. You can see simply by experiencing low instances of halo and glare. You can see satisfied. Join the many other patients who have found success with the Vivity lens. Embrace what's important in your everyday. Do more with revitalized vision.
Hello again. I trust that the short videos are helping you understand more about cataracts, treatments available, and how choosing the right lens can help enhance your vision and change the way you see the world. But when it comes to telling that story, no one does it better than someone who's experienced it firsthand.
Hi, I'm Barbara, and we are in my home just outside of Salt Lake City in South Jordan, Utah. We love the mountains. My husband and I have been married for 49 years, and we have 6 children, and right now 19 grandchildren. I'm very active. I like to hike. I go to the gym every morning. I've always loved to garden, to work out in the dirt and to grow, and I love being able to plant a seed and watch it grow into something that's really magnificent. I have done art my whole life, actually. I have focused on portrait work, and I love it. I've done commissioned work for different people, and I've done my own children and grandchildren. And it was my art that sent me to try to find a solution. I was extremely frustrated in how my eyes had become. Actually, I've worn glasses since I was in 3rd grade, so I've never had good eyes. You know, I couldn't see from a distance, and I couldn't see up close, and I couldn't see in the middle. But then, as I got the cataracts, the colors were fading, and I was just really frustrated with my eyes. Yeah, I quit driving at night. because I didn't want to hurt myself. I didn't want to hurt anyone else. I was fearful that I would go blind, to be honest. Finally, I called up the local institute here and asked them, is there anything you can do for me? And they told me about this PanOptix lens. And as they were talking to me, the hope just flooded over me, and I thought, there is a chance I am going to get this back. And I did not have 1 minute of hesitation. The doctor was absolutely wonderful, and he said that it could be back to normal eyesight. And I've never had normal eyesight. I have never been able to see without help. My vision after this surgery, I really had high hopes. Well, the first time that I walked in and for him to check me, he asked, how are you? And I said, I am fantastic. And he said, yes, you are. They said that I was 20/20 vision distance, 20/20 every single distance that they tested. I was just thrilled. I couldn't quit thinking about it. You know, I would walk around and look at this and look at that. I don't ever wear glasses at all. I drive anytime I want to now. I'm just so happy to be free. I've decided to start doing piano. Well, basically just because I could now. I don't have to be hunting for that sweet spot with glasses and tipping my head up and looking down. I don't have any sweet spots anywhere. It's all sweet. For reading, for my phone, for sewing, for threading a needle, for painting. Colors are more vibrant. It's vital to me in what I do. It has absolutely been a life-altering for me to have these eyes, and it also was a big change because I felt so much hope. This is a painting that I did after my eye surgery was done that depicts how I felt and my attitude. I called the painting Undaunted. Undaunted means can't be stopped and is full of hope. I had an instructor come up to me from my kickboxing instructor and give me a high five, and she said, I want to be like you when I grow up. I am never going to quit either. Because I just have this overpowering feeling of gratitude that this is a blessing to me, and I'm so thankful for it. I just love it. So here I am, 70 years old, and I have new eyes. My name is Barbara, and I am a panoptimist.
Hey, I'm Mary. I'm 68 years old and I live in Andrews, South Carolina with my husband. We have 2 children, Randy and Brian, and 5 beautiful grandchildren. I was struggling. I was afraid that I was going to lose my ability to do the things I really enjoyed doing, playing the piano or sewing or smocking. Those things I was having to put off and not do because I just couldn't see no matter what strength reader I had. I had glasses, bifocals, but they didn't work. They didn't help me. And when I went to my optometrist, she says due to the cataracts, there was no glasses I could wear that would help my vision, that I had to have the cataracts removed. The ophthalmologist recommended PanOptix. I trusted him. I said, let's go with it. And it was the best decision. I was anxious going down to Charleston. As I told my husband, I'm getting a little nervous about this, but it went so smoothly. Within 2 weeks, I was sitting at the piano, playing my music for church, no glasses. People didn't even recognize me because I didn't have glasses on, and they wanted to be sure it was me sitting there. Unreal. It felt unreal to be able to sit there and play. It was just fabulous. It was just fantastic. The lens have just made everything better. Everything is better. I don't use glasses at all. I don't even have readers. I put them all in my Salvation Army bag because I don't need them for anything. Near vision is great. Never been better that I can remember. I don't know if you're familiar with smocking or what smocking is, but there's tiny pleats, and you touch each one of those pleats numerous times to get your design on the dress. And I use no glasses for any of that. I don't need them. Like in a restaurant where there's dim lights, I've never had a problem reading the menu. My Bible is tiny print, and no problem. Reading, working at the computer, don't use glasses for anything. It's excellent. With the Panoptix, you didn't have to make the choice of whether you're going to see up close or you're going to see far away. You got it all in one hit, and I think that's fantastic. There's a tremendous difference in driving. In the car, I can see the odometer, I can read the sign on the side of the road, and I can read the sign at the next red light, so I'm fine. I don't have any trouble at all with intermediate vision. None. Don't need glasses or anything for that. I am a huge fan of just nature. I don't care if a tree has leaves or if it's naked. I think nature is beautiful. Those are my favorite things, just common, everyday things. Panoptix has been a relief for me. Now I do anything I want to without any type of glasses. All the things that I was having to slow down on doing, I picked right back up. I wouldn't change it. I wouldn't go back to glasses. I would not opt for another surgery. This is exactly what I needed, what I wanted, and I got everything I wanted in one package, one lens. My name is Mary, and I'm a panoptimist.
Hi, my name is Dale. My perfect day is when I have a smile on my face and the sun is shining. I'm 67. I live in Southlake, Texas. I'm a marketing director for an ophthalmology practice. I love what I do, and I absolutely love my coworkers, my work family. I was born in Brooklyn, New York. There are certain words that I use that make my Brooklyn accent come out more than other words. And they all love to make fun of me. But they say, Dale, say drawings. To have to constantly look for my glasses, it was really frustrating and annoying. I had like 6 or 7 pairs. When I was not wearing the reading glasses, I constantly had to change the lens power in the glasses because my vision was just continuing to get a little worse. We tried trifocals. Made me dizzy, so that didn't really work very well. It was suggested that I have surgery. Obviously, the goal was to be without glasses. After my surgery, I was just so relieved that after all this time, I could finally be glasses-free. It was just an amazing, wonderful feeling. The freedom of it was just wonderful. My vision at all distances is just perfect, whether I'm reading text messages on my phone, working on my computer, or driving. Well, not having to take those reading glasses on and off during cooking and baking and reading recipes, that's great because glasses during the cooking process is no fun. Having had the Panoptix lens means everything. The fact that after 25 years, I no longer have to wear glasses for anything that I do. It was relief. You know, I do not like overhead fluorescent lighting. So my office, I use dim lighting to work by. I had a little bit of concern about being able to work in dim lighting after my surgery. To this day, and it's been a year and a half since my surgery, I still work in dim lighting, and I've had no problem being able to read. I would say that it was the best decision I've ever made, and if anybody is considering Panoptix lens, I 100% recommend it. It's made me feel wonderful. Love my new eyes, and it was the best thing I've ever done. My cooking has probably not improved, but my eyesight definitely has. Hi, my name is Dale, and I'm a panoptimist.
So in boating, obviously, eyesight and distant sight is really important, but also near vision. The water around here is deceiving. It's all at the same level at the top, but the bottom changes rapidly in some cases from being, 20 feet deep to suddenly it's 1 foot. So you better be able to read that depth finder. My name's Bill. I'm 73. I'm a father of 4. We're on a place called Folly Beach in South Carolina. It's a beach town for Charleston. We can be downtown in 15 minutes. It's really pretty. It's kind of a visual feast. You turn a corner and you discover something new. I'm a commercial licensed pilot. I'm not very active as a pilot anymore. If I fly, it's usually as a co-pilot, not as pilot in command. I'm also a columnist for my own magazine and a columnist for Aviation Week. So I do some writing, but my main function is to serve as editor. Yeah, vision's kind of important for an editor. I'm on the computer all the time. I get a lot of hard copy. I read a lot of magazines. I read a lot of newspapers and try to get ideas. The nighttime driving really was a stopper. And finally, it got so bad, my wife laid down the law and she said, "You're not driving it at night anymore. We're done with that." My first surgery was December 20th, 2017. Right after the surgery, even on the way home wearing my sunglasses and what have you, I was startled to see that I could read the road signs. And honestly, I had not been able to do so. But 2 days after the surgery, I got in the car and I drove 740 miles in daylight and nighttime and really saw everything vividly. And I only had the one eye treated at that point. Now I take it for granted. Now I take for granted that I can read the signs, that I can drive at night, that things aren't jumping out at me or anything like that. You know, the headlights on the oncoming cars blossom a little bit, but it's not startling or anything like that. It's perfectly manageable. It does provide freedom. I think the panoptic lenses free you of compromise. I have near vision, I have middle vision, and I have far vision. The only glasses I wear are sunglasses, and there are no lenses in those. I can read this copy easily from here, and I can read it actually even easier from here, and I can still read it from here, though now it's getting close. The greatest benefit to me of the surgery and the Panoptix lens is that it has given me confidence in my visual ability. I'm just very satisfied and thankful. My name is Bill, and I am a Panoptimist.
Hi, my name is Sandy. I'm 66 years old. I live in Watertown, South Dakota. We're a town of about 22,000 friendly people. I have 3 grown children, and I have 13 grandchildren, which are the joy of my life. After I retired, I opened a gallery in downtown Watertown. My artwork, I think, is colorful, it's joyful. I like to fly by the seat of my pants and just start painting, and sometimes I don't even know what I'm going to paint. I just start putting color on and get a feel for what I'm doing, and I go with it. One of the local scenes that I've done is the Kemp Avenue Bridge, the stone bridge. It was sort of a gradual thing, so I didn't realize how bad it really was. So when I went to an optometrist and they tested my eyes, I was told that I was almost legally blind in one of my eyes for night vision. I was really surprised, and I thought, well, no wonder I don't like driving at night. I also noticed that with my artwork, when I was doing fine detail, my eyes, it was hard. It was a strain. My eyes would be blurry. It was hard to read fine print, and so I thought I needed a better prescription, and she told me that I actually had cataracts. One was pretty bad, the other one was getting there. Basically, my ophthalmologist told me that I might not have to wear glasses or contacts if I had the Panoptix lens implanted. So I had my first surgery, and I went back the next day to have my vision checked, and I already had 20/30 vision, which they said was really not usual. I couldn't have been more pleased. And so a month later, then I had my second eye, and once again, I had just a great result from it. I have not worn my glasses or my contacts once since my first surgery. My vision is so good that I just don't even, I take it for granted almost now because it's been a year. I feel more confident driving at night. At our lake cabin, I used to just wave at every boat that went by because I couldn't see who was on the boat, and everybody would wave back. But I didn't know if I really knew them or not. But now, since having my surgery, I can actually tell who most of the people are. So I can see far away like that. I can read without any difficulty, even really fine print. And my intermediate vision is good also. There is nothing that I can't do with my vision. It's been wonderful. My name is Sandy, and I am a pan-optimist.
Thank you so much for watching this video series. I know your time is valuable, and I appreciate you investing a little bit in educating yourself on the options for cataract surgery. We know how important your eyes are. We take that very, very seriously, and we want to make sure that we provide every option for you, and when you make this decision, that you're well informed so that you can have a great result. If you have more questions, please visit cataractsurgery.com or simply write them down and bring them in when you come in for your consultation. We look forward to taking care of you, and we'll see you soon. Thank you.